Thank you all for coming to Tribal Council.
Tilt table test confirmed that you guys were wrong. You're fired.
We're probably going to realize House has no idea what the diagnosis is himself and simply is using them to find it. Genius. Very excited to be reacting to House MD Season 4, Episode 3, 97 Seconds, requested by Amar Begic, our second ever channel member. Let's see if I can get the diagnosis before House does. This will be episode 28 of 177 because we're reacting to all of the House episodes. Interesting. So what we can see is that the patient in the wheelchair has some kind of disability, which could be cerebral palsy. He's in a wheelchair, looks emaciated and stiff, is young, can still speak, could be about 100 other diagnoses too. Now he's had sudden loss of consciousness with no warning and no limb jerking. That is what we call syncope, which there could be a few causes of. Could be a reflex, could be cardiogenic or neurogenic most commonly. Cardiogenic would be things like arrhythmia or hypertrophic cardiomyopathy. Reflex would be vasovagal or orthostatic hypertension. Neurological could be stroke or subclavian steal syndrome, when blood is taken away from the vertebral arteries and redirected to the upper limbs. There are some other causes too, but we can see what's most likely after we get some more clues.
37-year-old male who suffers from severe ascending muscle weakness.
Patient has spinal muscular atrophy.
Today you're gonna split yourselves into two teams. If your sex organs dangle, you're the Confederates.
Oh, this is very interesting. House is splitting up these prospective members of his teams by gender, male versus female. Don't know if this would pass the diversity and inclusion criteria in today's world, but we're in a very different world, 2007. One of the females also just requested to be on the men's team as a strategy because she likely thinks that women would be too emotional. I love these kinds of challenge episodes. It reminds me of 3 Stories, which is the highest rated episode ever.
Talking about House. He wouldn't be playing this game if he didn't already know the answer.
First thing we do is gangbang the sucker. Patient took a trip to Thailand 2 weeks ago.
Okay, so the first thing we need to think about with ascending paralysis is something called Guillain-Barré syndrome. Now that can be caused by a lot of things, but most common is a gastrointestinal infection, which is more likely in travelers. That could be how Thailand links in with this, but that is way too simple. We also know that he's got low bone mineral density and abnormal spinal curvature. So what else could cause ascending paralysis? Porphyria is a good one, botulism, myasthenia gravis, electrolyte-related neuropathies, diphtheria, meningoradiculopathies. We definitely want blood tests, CT head, and lumbar puncture in the first instance with MRI whole spine thereafter. But here's a question for you smart people. How do X-rays, CT scans, and MRIs work? Drop your answers down below.
I think when you went to Thailand, you picked up a threadworm called strongyloides. 2 pills.
We need blood, hair, and stool. You poop, and then you use the wooden sticks to collect the fecal matter.
Alright, so 13 has given him treatment for strongyloides, and the guy's best theory was that it was related to the dog. The girls don't think that's true since one of them was a vet, so it wouldn't be fair if that were the case. Now, House is a lot of things, but fair isn't one of them. Thinking laterally, I feel like whatever has affected the patient acutely now has also been what is causing his disability, leading to this diagnosis of spinal muscular atrophy. A really good one would be syphilis. Maybe he contracted it at birth, leading to his paralysis as a secondary disease, and now it has spread to tertiary, causing his acute deterioration. He would just need some penicillin and it could be completely cured. Could have also got it in Thailand. He wouldn't have been the first.
It's called Xenodiagnosis. We let these bugs bite you and then we test their feces for parasites.
Testing the bug's feces is actually more accurate than testing yours.
Get the bugs off him.
Have the bugs feed on the patient's healthy tissue. This cutthroat doc is earning her name. Xenodiagnosis is used to confirm Chagas disease only in rare cases, and they take the blood sample and then give it to the bug as a suitable vector first, not give the bug free roam on the patient's skin while he seems to be choking on milk of magnesia. Now, parasites in medicine are not a new thing. For over a century, maggots have been used to clean wounds. The first maggot therapy was used in the 19th century American Civil War to help clean festering wounds. Thousands of practitioners use this technique today, and many control studies have shown that they're an effective way of cleaning wounds that are conventionally non-healing and potentially saving limbs. Disgusting but effective.
Get the bugs off him.
Test isn't done.
He's choking.
Patchy infiltrates on the X-ray. Patient improved with chest PT and oxygen.
Oh, patchy infiltrates and aspiration. This is getting spicy. One cause that might fit is he could have leukemia with pulmonary infiltrates or pulmonary hemorrhage due to Wagner's or Churg-Strauss, although that's not what they're called anymore. Could also be lupus. I'm definitely looking at the autoimmune causes right now as my primary disease category.
We could stress his system, put him on a tilt table. If he stays conscious, means we made the right diagnosis and we win.
One of the men's gonna have to join the women's team. On the other hand, one of the men isn't an actual doctor, so I guess it's pretty fair.
House is going through a recruitment process right now. And you might think this fake doctor thing is dramatized, but recently in the UK, a person named Zolia Alemu was practicing as a psychiatrist for 20 years after forging a medical degree. She was a medical student in Oakland, but failed a few of her years and decided to forge a certificate and send it across to the General Medical Council in 1995. How she was caught though is she forged an 84-year-old woman's will to make herself the beneficiary of her possessions and forged power of attorneys as well. Total madness. The General Medical Council have had to apologize for their error and any harm that come to patients because of this.
Paramedics said I was technically dead for 97 seconds. It was the best 97 seconds of my life.
Near-death experiences are a very interesting phenomenon. What's even more interesting is that only 17% of people who are about to die actually have a near-death experience. Many different wonderful things have been documented, like people who've been blind their whole lives being able to see again, and out-of-body experiences. This phenomenon makes scientists question what we understand about consciousness, and research is underway to try and recreate these near-death experiences as using a psychedelic called DMT. The theory is that we think of consciousness as a straight line from comatose to hyper-alertness, but what if there are other forms of consciousness and we are just scratching the surface? Or not, and this is all there is. But it could be worse. We could be on Pluto. Is it a planet? Is it not a planet? Who knows? If you're enjoying this video and you'd like to take the next step in supporting this channel, improve our content, then check out the channel membership down below. You also get some great perks like being able to suggest videos for me to watch and early access to new videos. For a limited time only, we have a Hall of Fame which lets you etch your name in the channel's history forever. It's open to the first 10 members. There are only 4 spots left, so go secure your place now. Once we fill the Hall of Fame, we will be having a members only live stream, so press join to secure your place and give us your support.
Paraganglioma. Out-of-body tumor causes trouble swallowing. Food presses against the vagus nerve and causes the fainting.
We need a CT to prove it.
And does House's computer have a built-in microphone?
Uh-oh, some shady business now going on between the teams. Just before, the boys were writing down the wrong things on the board. Then they went to ask the patient what treatment the ladies had given. And now it seems like someone is listening in on their differential. So a paraganglioma is a very slow growing neuroendocrine tumor. They develop across the autonomic nervous system and release too many catecholamines, which prepare the body for fight or flight response. The first step to diagnosing it is a 24-hour urine collection for catecholamines. Interestingly, the same genetic mutation that causes paragangliomas also causes pheochromocytomas. This patient's symptoms won't be a paraganglioma though, since it wouldn't really cause patchy infiltrates in the lungs, and rarely would it cause syncope. It's more likely to cause hypertension than hypotension. Let's see what the next clue is then on this diagnostic roller coaster.
Blood pressure's remaining stable through 60 degrees.
Our treatment worked. BP and pulse remained normal despite
Who are you,
considerable
13? The fact that you want to answer my questions tells me more about you than answers could. You got something worth hiding.
Interesting, so it seems like 13 left a lot of blank spaces on her application form, which is leading House to go into this curious line of questioning. I love the character development here, and House gamifies this whole medical field. Does make it a lot more fun. It's definitely not this dramatic in real life.
Thank you all for coming to Tribal Council.
Tilt table test confirmed that you guys were wrong. You're fired. You ladies have the honor to give the patient a feeding tube.
Interesting, so CT scans showed no paraganglioma, but did show some esophageal straightening. The female doctor that switched teams then suggested it could be scleroderma, but House thinks it's simply due to his spinal muscular atrophy. I tend to agree with her and reckon the patient's actually going to get worse now. Even after House fired half the team, we're probably going to realize House has no idea what the diagnosis is himself and simply is using them to find it. Genius.
Do you think House could be wrong? If he is, how would I prove it?
You have to run a blood test for anti-centromere antibodies.
Got my blood. It's green.
It means I'm not fired.
What? He has green blood. There's only one thing that can cause that. Hulk serum. No, it's actually self-hemoglobinemia from excessive exposure to sulfur-containing compounds like sulfonamides or fertilizer. It's basically when a hemoglobin molecule incorporates a sulfur molecule into its structure, creating self-hemoglobin. It's similar to carbon monoxide poisoning in that the sulfur within the hemoglobin chain stops an oxygen atom from joining, leading to dark blue, green, or even black blood. Patients with the condition usually have cyanosis or blue fingertips, which this patient doesn't actually have. Usually it resolves on its own, but I'd be very interested to see how this happened. Could it have been the strombolitis medication? Let's find out.
What contrast did you use for the CT?
ICM.
His kidneys aren't working. They didn't filter the contrast, which in ICM is green.
10 points.
Now we're on the point system?
Forget the damn game! You were diagnosing, now I am too.
It was a contrast! Welcome to the book of medical fiction. ICM stands for iodinated contrast media, and for CT scans, this is iodine based. Even though it looks radio opaque on examination, it actually is clear looking at it directly. Even with kidney failure, it wouldn't turn green. Now, radiologists are also very paranoid about patients with kidney failure, and so they always check what the kidney function is before giving contrast. So the only other option is that the contrast caused the nephropathy, which can happen in as many as 5% of patients who have risk factors for it. Now with the episode, things are getting spicier and spicier as House now sits in the realms of uncertainty since we don't know what this is.
The patient developed pneumonia. His lungs are filling fast.
He doesn't have scleroderma. Biopsy revealed no fibrotic changes.
Cervical lymph node has black flecks.
You want to remove his eye?
Cervical lymph node is a garbage dump.
A few inconsistencies here. Recently, they spoke about how the tongue and the eye shared lymphatic drainage to the cervical lymph nodes, and now all of a sudden House is so confident of a source in the eye that he wants to pull it out just because of a positive lymph node. Do an MRI of his orbit. Look into his eye with an ophthalmoscope or slit lamp. There are so many options here that don't mean taking out the man's eyeball straight away, but sure as hell makes for good television. What I would be doing here, since there was some necrosis in the node with infiltrates in the lungs, is checking for a little condition called necrotizing sarcoid granulomatosis or TB, which could cause basically all of the patient's symptoms and have eye involvement. It's very treatable with immunosuppressants, which they've surprisingly not tried. If you think he could have one autoimmune condition like scleroderma, why only check for that condition? It's like trying to catch a guppy in the sea with a harpoon instead of a net. Broad and wide, my friend, especially before swapping someone's eye for a magic 8-ball.
You're telling me that the rest of my life is in this bed, puking in pain? I'd rather just get this over with. It'd be nice to finally get out.
The patient just said that he's been trapped in this useless body for long enough, and it's so hard to understand what patients with chronic diseases like this feel like. It must be extraordinarily frustrating, and many don't appreciate the day-to-day difficulties that patients like this have that most of us actually take for granted. Things like going to the toilet on your own or getting dressed. Especially when these conditions are progressive and you feel your dignity is gone, finding hope can be very tough. However, there is hope with the shift in perspective from what you can't do to what you can do, some patients with these conditions can get a quality of life again and find things that they enjoy. Really tough situation though.
You're not getting enough oxygen, so we're inserting a tube directly into your lungs, which should help us drain some of this excess fluid.
Fluid's clear. If this was cancer, there should be blood.
Wow, okay, a lot to go through here. First of all, the procedure they're talking about is a pleural effusion aspiration, which is when you have a fluid around the lungs. Cutthroat doctors said they were going to put a tube in the lungs, but that means you've definitely gone too far. You may say, who cares? Well, the lung is like a giant balloon and breathing functions because the pressure in the thoracic cavity is negative. The pressure gradient between that and the lungs are actually what control the mechanism of breathing. Think of the thoracic cavity like the inside of the hoover that creates the suction. So when you make a hole in the lungs, air begins to fill the chest cavity and it starts to lose that negative pressure. That leads us to the second problem here, which is that the drain that they're leading into the chest has no valve inside it. That means that things go out of the chest but not back in. Usually that's either done with a machine or an underwater seal, and it should be placed on the floor below the patient so that fluid is draining with the support of gravity, and so the chest is more likely to drain dry of its fluid. Anyways, the granulomatous disease theory is looking more likely right now. Let's see.
Dr. House!
What the hell? Okay, I thought House couldn't surprise me anymore, but here I am, as surprised as a baby being born. Early in the episode, a patient did the exact same thing because they were trying to have a near-death experience. Should have just taken some DMT. House clearly just did this to see if the patient was right about the euphoria he felt, or that there was something on the other side. Especially since the spinal muscular atrophy patient was saying he wants to give up and leave his body. Interestingly, Foreman is struggling with a case in parallel, somewhere else at the moment with his own team, but I'm not quite sure how he got there, and it seems like Chase and Cameron are in the same hospital but not working for House anymore. Some crazy stuff is going on. Can't wait to see how it all happens. Also, this girl needs to be fired. She's in a hospital, hasn't even asked for help. Is she gonna revive him solo without a defibrillator? Electricity pudding there. Electricity needs to bring him back. Bring in Jules.
His heart stopped for nearly a minute, but he has not regained consciousness.
Is he better?
No, but he doesn't have cancer. We think it might be eosinophilic pneumonia.
Starting on cyclophosphamide.
He's awake! Damn, House. Wilson is so unsurprised by your antics that he can just walk around being like, oh, House has done a House thing again. One of the things House asked when waking up is if the original patient who put the knife in the socket was alright, but it seems like he has passed away. House wanted to talk to him about what he saw. I'd be very interested to know. Now, it looks like their primary working diagnosis is eosinophilic pneumonia, which is more a symptom than a diagnosis. It's a very rare disorder caused by smoking, allergy, or parasitic infection. Tends to be rapidly progressive and likely leading to acute respiratory failure. Treatment is with steroids or immunosuppressants and treating the underlying cause. I mentioned autoimmune, but not quite this diagnosis, to be fair. And we don't even know if this is what it is.
Can you get over?
It's okay. Time of death? Stark's dead.
Dealing with losing a patient can be such a tough situation. Many people try and process it using phrases like, at least they're not suffering anymore, or they're in a better place. But as a patient's doctor, it's hard not to take it personally, especially if it happened as a shock. We had a young 30-year-old patient register with our surgery recently, and about 2 weeks later we received a notification that she had passed away. None of us had seen her. She had no significant past medical history, and we had no idea how she had died. We only found out as the coroner had sent us an email asking if we could issue a death certificate, which we couldn't. Thinking back, all these questions come to mind, like, should we have a different policy with regards to contacting new patients? What else could we have done? It's tough. Many doctors hold things like this as demons that change their practice or make them more cautious in certain situations. Seems like Foreman had a similar thing early on in the episode too, when he'd irradiated someone inappropriately for cancer treatment and it went wrong. Props to House though for actually not always having a happy ending, because that's how it is in real life.
What's wrong with the dog?
He's dead.
Did you watch him take the pills? The ivermectin. Did you watch the patient put them in his mouth and swallow them?
Now the dog is dead too! God, I'm gonna need some sertraline after this episode. So depressing. Silver lining though, seems like our patient didn't actually want to live, which he told us earlier in the episode. This is why it's so important that doctors actually listen to their patients. For the first minute of a consultation, we're actually trained to give the golden minute. In that time, we're not supposed to interrupt anything the patient says and let them talk. Most of the vital information we need is from that time. That's why House's everybody lies doesn't really hold true that well in the real world. But he isn't operating in a normal medical field. He's seeing the zebras after all the horses have been ruled out by other doctors and they've failed. It's just as Einstein said, we can't solve problems by using the same kind of thinking as when we created them. Damn, seems like the patient fed the dog the ivermectin and killed it. Dark.
I think the last time you saw it didn't have that dead dog's teeth marks on it. When I asked you if you watched the patient swallow the pills, the right answer was no.
Ouch! So this dog had the antiparasitic agent ivermectin, which was toxic because this breed of dog has what we call the MDR1 gene, or the multi-drug resistance mutation. This makes collies extremely sensitive to neurotoxicity induced by ivermectin. This was published in the 2001 Journal of Pharmacogenetics. Quite impressive that the writers found it, as it is very niche information, but so is most of House.
Got your call.
Thanks.
It wasn't a compliment. I'm sorry, Dr. Foreman, you're fired.
Forget the lecture and fire me already.
If I was gonna fire you, I wouldn't be giving you the lecture.
Oh, this part of the show beautifully demonstrates the difference between House and other doctors. House's doctor killed the patient with a mistake, and he hired her because he knew that she'd never make the mistake again, and he put his faith on the other side of imperfection to give her a chance. Whereas Foreman stuck his neck out and saved a patient and got fired for being too risky. I don't know how Foreman ended up in this other center, but something tells me he's gonna want to come back pretty soon. With stories like this, you're gonna have to watch another here. Stay curious.